I think there's a ton of examples on how we can kind of use these new technologies. Let's take the basic one. I feel like every hospital I've ever worked at, we have always spent so much time looking for wheelchairs, right? They just seem to disappear. Putting a simple sensor on these wheelchairs will help us locate them in real time. And that's just a very small, mundane example, but you can apply that kind of globally, right? Spending less time looking for things. Um, I think IoT sensors in terms of identifying water leaks is huge. That's a huge opportunity. Our healthcare facilities are generally very old. The infrastructure is not new. And there are, there's every day there are different events that are coming sort of at you at all times. And so being able to integrate, IoT to detect water leak before it hits a critical electrical panel that could cause a much larger downstream event, that's a huge opportunity. Detecting mold growth, another opportunity to, decrease hospital-acquired infections. When it comes to patient satisfaction, I think giving patients just more control, right? If they're able to control the temperature in their patient room, right, and they don't have to tell the nurse or the MA, and then the MA has to put in a work order to facilities, right? That's a lot of steps in the process when, if it's just a 2-degree, 3-degree change that they want and they can control that at their room, why would we not give that to them? I completely agree, Nelson, with you. I think that asset management is a huge component here. I think enterprise asset management, we have a lot of health systems out there. And so the opportunity to link, assets across your whole enterprise and understanding, what's being used, how much is being used, is going to allow us to optimize for the future. And I think one of the biggest frontiers for me is really energy management, right? We're really on this quest in, Seattle's, there are a lot of laws and requirements for us to reduce our carbon footprint, and the opportunity to optimize our HVAC systems and other locations that aren't being used, not having the lights on, right? Not being able to turn down air exchanges if it's not occupied. All of that ultimately is going to save money and save energy for the hospital, which is only going to, again, benefit the patient at the end.